Hello, everyone. So by popular demand, the next topic I'm going to cover is the topic of health insurance. And I think I'm probably going to turn it into a mini series given how complex the health insurance system is in the United States. But let's start with like a 50,000-foot view and look at how other countries around the world provide insurance to their citizens. And contrary to popular belief, it's not all socialized medicine. So one useful framework for classifying healthcare systems around the world has been provided by the Organization for Economic Cooperation and Development, or OECD, which is a global think tank that's been around since 1948, and healthcare is one of the policy issues that they look at. And here's how they classify healthcare systems. So they start with kind of a first layer of who provides the healthcare services, either private healthcare professionals or the government. The next layer is who provides insurance. So we have either private insurance with base coverage or public insurance with base coverage. And here is how the different countries stack up. So primarily private providers and private insurance. We have Germany, Netherlands, and Switzerland. This is also known as the Bismarck model. Private providers and public insurance with base coverage. We have Belgium, Canada, and France. And this is also known as the national health insurance model. On the flip side, we have the government providing both healthcare and insurance. And here they do a cut of gatekeeping and no gatekeeping. Gatekeeping implies that you need a referral from a primary care provider or general practitioner in order to seek specialty services. So here's how the countries stack up here. On the no gatekeeping side, where you can go directly to a specialist, you have Iceland and Sweden. On the gatekeeping side, where you have to first get PCP referral, we have Denmark, Norway, and the UK. And this is also known as the Beveridge model. Now, take a moment and think about it. Where in this framework do you think the US fits in? Is it like Germany, Netherlands, or Switzerland? Are we more like France and Canada? Or are we all the way together with Denmark, Norway, and the UK? So, well, it turns out we have a little bit of everything. We have the private system, private providers, private insurance for folks that are covered through employer-based coverage or individual insurance, private insurance purchased through the exchanges, and the Federal Employee Health Benefit Plan, which we'll touch on some more in the series. We have private healthcare providers, but public insurance with Medicaid and Medicare. And then we also have the equivalent of a UK-style model, where the government is both the payer and the provider with the Indian Health Service and the VA. So we are very different from other industrialized countries. We don't have a single health system for our citizens. We have different ones depending on someone's age, their income, their employment status, and other characteristics.